Economics of healthcare: access, cost, and quality. The healthcare sector is a fundamental part of every economy, impacting both individual well-being and national economic performance. As one of the largest sectors in many countries, the economics of healthcare involves understanding the complex dynamics of access, cost, and quality. These three pillars form the foundation upon which healthcare systems operate and significantly affect the health outcomes of populations. Balancing the need for high-quality care with the rising cost of healthcare and ensuring equitable access for all remains a challenging task for policymakers worldwide. The economic significance of healthcare. Healthcare is a significant part of any economy, not only in terms of its direct economic contribution, but also its broader impact on productivity and workforce participation. Healthy populations are more productive, less likely to miss work due to illness, and more likely to participate in the labor market. Additionally, the healthcare industry itself generates millions of jobs and stimulates economic growth through the provision of services, medical research, or technological innovations. However, balancing the economic contribution of healthcare with its rising costs is a persistent challenge for both public and private sectors. The link between health and economic growth. Good health is directly correlated with economic growth. Healthier populations experience higher productivity levels, fewer sick days, and greater economic output. This relationship is especially evident in developing countries, where improved healthcare can lead to enhanced economic development by increasing the labor force's efficiency. In contrast, poor health and widespread disease can lead to lower productivity, higher healthcare costs, and a greater burden on economic systems. As such, investing in healthcare is not only a moral imperative, but also an economic strategy for long-term growth. Access to healthcare, a key factor in economic prosperity. Access to healthcare refers to the ability of individuals to obtain necessary healthcare services when they need them, without undue barriers such as cost, geographical location, or social status. Inadequate access to healthcare can result in unmet health needs, worsened health outcomes, and increased economic costs in the form of lost productivity, increased mortality, and greater dependence on emergency care. Ensuring broad access to affordable healthcare is essential for enhancing public health and economic stability. Health insurance, a mechanism for expanding access. Health insurance helps individuals offset the cost of medical care, ensuring that even those with lower incomes can access necessary treatments and services. The economics of health insurance involves understanding the balance between premium costs, coverage benefits, and out-of-pocket expenses for individuals. Efficient insurance systems can increase access to healthcare while reducing the financial burden on households. However, poor design or inefficiency in insurance schemes can create barriers to care or escalate costs. Healthcare costs and their economic impact. In many countries, healthcare expenses account for a substantial portion of public and private spending. Rising healthcare costs are driven by various factors, including the aging population, advancements in medical technology, increased demand for healthcare services, and the prevalence of chronic diseases. These costs impact government budgets, the private sector, and individual households, leading to difficult trade-offs between funding other public services and maintaining sustainable healthcare systems. The rising cost of healthcare, causes and consequences. The primary drivers of increasing healthcare expenses include the growing prevalence of chronic diseases, aging populations that require more healthcare services, the increasing cost of medical technologies and pharmaceuticals, and rising labor costs in the healthcare sector. For governments, rising healthcare expenses may mean reallocating funds from other sectors, potentially reducing investment in education, infrastructure, or social services. For individuals, higher out-of-pocket expenses can create financial strain, especially for those without adequate insurance coverage. Cost control measures, strategies for managing healthcare expenses. These include negotiating drug prices, setting caps on hospital fees, promoting preventive care to reduce the incidence of chronic diseases, and exploring alternative models of care delivery, such as telemedicine or outpatient services. Effective cost control measures can help ensure that healthcare remains accessible and affordable for all individuals, while maintaining the quality of services provided. However, these measures must be carefully designed to avoid unintended consequences, such as reduced access to care or decreased provider incentives. The quality of healthcare services, measuring and improving outcomes. Quality in healthcare refers to the standard of services provided to patients, including the effectiveness of medical treatments, the safety of care, and the patient experience. High-quality healthcare systems improve patient outcomes, enhance satisfaction, and reduce the likelihood of errors and complications. Economic analysis of healthcare quality focus on optimizing healthcare delivery to maximize patient benefits while minimizing unnecessary costs. Monitoring and improving healthcare quality is an ongoing challenge as it requires continuous investment in healthcare infrastructure, workforce training, and technological innovations. Health inequalities and economic disparities. Differences in health outcomes between socioeconomic groups often reflect broader economic disparities. Individuals from lower income backgrounds may face significant barriers to accessing quality healthcare, resulting in poorer health outcomes and increased economic vulnerability. Addressing health inequalities requires targeted investments in healthcare infrastructure, education, and policies that ensure equal access to high-quality care for all individuals, regardless of their economic or social status. The role of public versus private healthcare systems. Healthcare systems can be broadly classified into public and private models, each with distinct economic implications. Public healthcare systems funded by government taxes aim to provide universal access to healthcare services, typically at low or no cost to individuals. While this model aims for equity and access, it can place a significant strain on government budgets. Private healthcare systems, on the other hand, are often funded through private insurance or out-of-pocket payments and may offer high-quality services, but can lead to inequality in access to care. The balance between public and private healthcare plays a significant role in determining overall healthcare access, cost, and quality. The role of technology in reducing healthcare costs. Advances in medical technology such as diagnostic tools, electronic health records, and telemedicine can streamline healthcare delivery, reduce inefficiencies, and cut costs. Additionally, technology can improve patient outcomes by enabling more accurate diagnosis, enhancing treatment options, and improving access to healthcare in remote areas. However, the initial investment in healthcare technology can be high, and its integration into existing systems requires significant planning and resources. The global healthcare crisis, COVID-19 and its economic fallout. The COVID-19 pandemic has brought global attention to the economic and public health challenges of healthcare systems. The pandemic has underscored the vulnerability of healthcare systems and the critical need for robust public health infrastructure. Economically, the pandemic has led to unprecedented government spending on healthcare, as well as sharp contraction in the global economy. The long-term economic impact of the pandemic will depend on how countries manage the recovery process, address healthcare needs, and rebuild economies that were disrupted by the crisis. Future directions in healthcare policy. Future healthcare policies will need to address the evolving needs of populations, especially in light of global demographic changes, technological advancements, and the continuing rise in healthcare costs. Policymakers must balance improving access to healthcare, managing expenses, and maintaining quality. The focus will likely shift toward promoting preventative care, integrating digital health technologies, and ensuring that healthcare systems are adaptable to future challenges, including pandemics, aging populations, and changing disease patterns. The role of healthcare in national economic development. Healthcare is closely intertwined with the nation's overall economic development. Healthy populations are more productive, more innovative, and better able to contribute to the economy. Investing in healthcare not only leads to better health outcomes, but also promotes economic stability and growth. In emerging economies, improving access to quality healthcare is essential for fostering economic development and reducing poverty. As such, healthcare should be seen as an investment in a country's human capital with significant returns in terms of economic growth and prosperity. The economics of healthcare is a complex field that requires careful attention to the interplay between access, cost, and quality. Achieving a balance between these factors is crucial for ensuring that healthcare remains both affordable and effective, while also contributing to economic growth and development. As healthcare systems continue to evolve, it's essential for policymakers to design strategies that enhance access to care, control expenses, and improve the quality of services provided.